I'm Dr. Sharda Jain. Today I'm going to talk on a very, very important topic, burnout and beyond in Indian doctors. Burnout has emerged as a very critical and a growing crisis among Indian doctors, resulting not only affecting the individual mental health, but also the healthcare delivery and public well-being as a whole. I know personally my daughter, after doing MBBS, did her further training in USA, and many of her cousins also did the same thing. It is mandatory that after 8 hours of work, if you're working in the wards, the senior sister will come and tell, look, doctor, you're working for more than 8 hours. You can't work beyond this because it is going to affect the quality of your care for your patients. So take off, go home. It has been mandated and you have to do this. But there's something of that kind is not existent in India. Doctors' burnout in India is marked by prolonged work hours. Quite a few work for more than 60 hours per week. And this prolonged work hours drains them emotionally, they're exhausted, and have a chronic sleep deprivation. This affects 50% of our doctors. Young females, resident doctors, are especially vulnerable, with over 85 to 90% of female doctors reporting mental exhaustion and burnout. And this is more so in smaller towns. WHO says the ideal ratio of a doctor patient should be 1 in 1,000, while doctor to patient ratio in India is something like 1 in 11,000. Teachers and elders tell that you should tough it out. Professionally, I have to काम तो करना ही पड़ेगा. And this results, to my mind, in underreporting due to stigma and the fear of professional repercussions. Personal, workplace, patient-related stress is seen 1 in 4 doctors these days. Result है कि it is seen in the form of depression in 30%, anxiety in 15%, substance abuse in 15%, and some even have a suicidal thinking. Nearly half of the doctors feel undervalued, and 1 in 2 doctors get less than an hour daily for personal life. What is the impact? The impact is very clear. Burnout causes medical errors, impaired judgment, diminished empathy for patients, and directly impacting health care quality of themselves. The ripple effect is seen in a strained patient-doctor relationship and compromised safety standards. Half of the doctors feel pressured to act against the medical code of ethics. Solution क्या है? We have to be realistic. Doctors' bodies, institutional support should be there enforcing reasonable working hours, providing mental health support, destigmatization, and help seeking behavior can aid recovery. There should be peer network and mentorship. Will bring out shared solutions, especially for young doctors in challenges in their period of training. We also teach them work life balance, prioritizing ethics over unrealistic targets, and rebuilding general practice system to ease specialist overload are crucial steps. What is the future? The issue has been brought to the center stage. Helplines, wellness programs, grassroots campaigns are required. Addressing burnout among doctors is our obligation, that the society should stand for doctors. Doctors' body should stand for doctors, ensure their mental health, dignity, and compassionate service of every Indian doctors and patient. I think these are few thoughts of mine. Give a little thought to it and help in rationalizing solution.